My name is Tembi Zungu, and I come from the organization called 50 Plus that was initiated because of a need of focus on people who are aging with HIV and have been on treatment for quite a long time. This came as a result of a scoping exercise which we conducted from I think it was January 2023 to around April, looking at the prevention, treatment and psychosocial support needs of people living with HIV aging at 50 plus in the 15 districts in South Africa. So we went through the whole of South Africa in the 15 districts. So imagine from Limpopo to Cape Town. So it was a long ride. But when we scoped, we found that people who are aging with HIV are actually not part of their health programming, in a sense that the age 50 means you are at home, you are close to retirement, sometimes you are unemployed for certain reasons, and some are feeling that they are on the sides and do not know what is happening around health. So they want to be brought back to care within the care programs. This is the reasons why we have joined the 1.1 million campaign as the 50 plus, because part of the numbers that the National Department of Health has actually shared that need to be reached. It's about 54,000 people who are age 50 plus who have not been initiated on treatment, and some need to be supported to stay on treatment. So as I am here to contribute part of the theory that we need to, when we start and stay on treatment for the older people, consider their context, where they are coming from, their cultures, their gender, and the needs for increasing the screening for non-communicable diseases, because as we age, there is an increase in actually the incidence of non-communicable diseases, including TB and other co-infections.
My name is Lawrence Sewan. I'm working for NAPWA as a provincial manager, and we are also in partnership with 50PlusProjects, and we are now here with the 1.1 million treatment gap campaign. Now, as we look at Limpopo, we are seeing numbers. Numbers have been presented. We have males at over 2,000. However, as a male, I'm concerned to say this number that has been raised on male is not enough. We have to re-establish support groups to work around the issue of getting all these missing women back to facilities, because of its critical. One other component that I think will be of great importance is to have partners supporting their women, males in particular, supporting their women to take treatment, because there's where also the gap is. So we are fully behind the project and we are ready, though we have some challenges in terms of resources. But speaking out about this project, I think our government will look at ways on how to support us, because if we don't have resources to go to all these other areas where people need these services.
In South Africa, HIV medications were started in 2004 by the South African government. So imagine having lived from that process when there was no treatment, and then there is treatment, that you start something that you've never seen anywhere. You don't know what is it going to do in your body, but you get to know from health workers how HIV medication work. So I can confirm that it is really possible to start and stay on treatment every day, as long as you take your treatment every day. And we've seen with the 50 plus that they are virally suppressed. Data shows that they are virally suppressed, but the challenges are coming with other conditions that actually come with their burden of treatment. Let me make an example. you have hypertension, you've got diabetes, you've got cancers. So the bulk of medication gets added to your HIV medication. Does that make you stop? No, you adapt as you go. Work with your doctors, work with your peers to stay on treatment, because life is unpredictable. I have lived with HIV for more than 3 decades, and I've been on ART for about 22 years. Currently, I can safely say I am below 50 copies, which means I am virally suppressed. And that means if my virus is undetectable, it's untransmittable to the next person. So I'm an advocate that ARVs work. This year, I am turning 58.
Just to add on to her story, I've been living with HIV for the past 29 years. I'm also in that situation. Positive living, treatment, complemented with nutrition. Everything is possible.